Question 181. A female client complains of gnawing epigastric pain for a few hours after meals. At times, when the pain is severe, vomiting occurs. Specific tests are indicated to rule out A. Cancer of the stomach, B. Peptic ulcer disease, C. Chronic gastritis, D. Pylorus spasm. Question 181. Answer: B. Peptic ulcer disease. Question 181. Explanation: Peptic ulcer disease is characteristically gnawing epigastric pain that may radiate to the back. Vomiting usually reflects bile or spasm from muscular spasm or obstruction. Cancer, 181, would not evidence pain or vomiting unless the pylorus was obstructed. Question 182. The client has orders for an esophageal tube insertion. During the procedure, instructions that will assist in the insertion would be: A. Instruct the client to tilt his head back for insertion in the nostril, then flex his neck for the final insertion. B. After insertion into the nostril, instruct the client to extend his neck. C. Introduce the tube with the client's head tilted back, then instruct him to keep his head upright for final insertion. D. Instruct the client to hold his chin down, then back for insertion of the tube. Question 182. Answer: A. Instruct the client to tilt his head back for insertion in the nostril, then flex his neck for the final insertion. Question 182. Explanation: An insertion technique is to have the client first tilt his head back for insertion into the nostril, then to flex his neck forward and swallow. Extension of the neck, 182, will impede ang tube insertion. Question 183. Which of the following best describes the method of action of medications, such as ranitidine, Zantac, which are used in the treatment of peptic ulcer disease? A. Neutralize acid. B. Reduce acid secretions. C. Stimulate gastrin release. D. Protect the mucosal barrier. Question 183. Answer: B. Reduce acid secretions. Question 183. Explanation: Ranitidine is a histamine 2 receptor antagonist that reduces acid secretion by inhibiting gastrin secretion. Question 184. A 40-year-old male client has been hospitalized with peptic ulcer disease. He is being treated with a histamine receptor antagonist, cimetidine, antacids, and diet. The nurse doing discharge planning will teach him that the action of cimetidine is to A. Reduce gastric acid output, B. Protect the ulcer surface, C. Inhibit the production of hydrochloric acid, HCl, D. Inhibit vagus nerve stimulation. Question 184. Answer: A. Reduce gastric acid output. Question 184. Explanation: These drugs inhibit the action of histamine on the H2 receptors of parietal cells, thus reducing gastric acid output. Question 185. A client is to take 1 daily dose of ranitidine, Zantac, at home to treat her peptic ulcer. The nurse knows that the client understands proper drug administration of ranitidine when she says that she will take the drug at which of the following times? A. Before meals, B. With meals, C. At bedtime, D. When pain occurs. Question 185. Answer: C. At bedtime. Question 185. Explanation: Ranitidine blocks secretion of hydrochloric acid. Clients who take only 1 daily dose of ranitidine are usually advised to take it at bedtime to inhibit nocturnal secretion of acid. Clients who take the drug twice a day are advised to take it in the morning and at bedtime. Question 186. When counseling a client in ways to prevent cholecystitis, which of the following guidelines is most important? A. Eat a low-protein diet. B. Eat a low-fat, low-cholesterol diet. C. Limit exercise to 10 minutes, day. D. Keep weight proportionate to height. Question 186. Answer: D. Keep weight proportionate to height. Question 186. Explanation: Obesity is a known cause of gallstones, and maintaining a recommended weight will help protect against gallstones. Excessive dietary intake of cholesterol is associated with the development of gallstones in many people. Dietary protein isn't implicated in cholecystitis. Liquid protein and low-calorie diets, with rapid weight loss of more than 5 pounds, 2.3 kilograms, per week, are implicated as the cause of some cases of cholecystitis. Regular exercise, 30 minutes, 3 times a week, may help reduce weight and improve fat metabolism. Reducing stress may reduce bile production, which may also indirectly decrease the chances of developing cholecystitis. Question 187. Which of the following would be an expected nutritional outcome for a client who has undergone a subtotal gastrectomy for cancer? A. Regain weight loss within 1 month after surgery. B. Resume normal dietary intake of 3 meals per day. C. Control nausea and vomiting through regular use of antiemetics. D. Achieve optimal nutritional status through oral or parenteral feedings. Question 187. Answer: D. Achieve optimal nutritional status through oral or parenteral feedings. Question 187. Explanation: An appropriate expected outcome is for the client to achieve optimal nutritional status through the use of oral feedings or total parenteral nutrition, TPN. TPN may be used to supplement oral intake, or it may be used alone if the client cannot tolerate oral feedings. The client would not be expected to regain lost weight within 1 month after surgery or to tolerate a normal dietary intake of 3 meals per day. Nausea and vomiting would not be considered an expected outcome of gastric surgery, and regular use of antiemetics would not be anticipated. Question 188. Which of the following conditions can cause a hiatal hernia? A. Increased intrathoracic pressure. B. Weakness of the esophageal muscle. C. Increased esophageal muscle pressure. D. Weakness of the diaphragmatic muscle. Question 188. Answer: D. Weakness of the diaphragmatic muscle. Question 188. Explanation: A hiatal hernia is caused by weakness of the diaphragmatic muscle and increased intra-abdominal, not intrathoracic, pressure. This weakness allows the stomach to slide into the esophagus. The esophageal supports weaken, but esophageal muscle weakness or increased esophageal muscle pressure isn't a factor in hiatal hernia. Question 189. Which of the following tests can be performed to diagnose a hiatal hernia? A. Colonoscopy. B. Lower GI series. C. Barium swallow. D. Abdominal X-rays. Question 189. Answer: C. Barium swallow. Question 189. Explanation: A barium swallow with fluoroscopy shows the position of the stomach in relation to the diaphragm. A colonoscopy and a lower GI series show disorders of the intestine. Question 190. After a subtotal gastrectomy, the nurse should anticipate that nasogastric tube drainage will be what color for about 12 to 24 hours after surgery? A. Dark brown. B. Bile green. C. Bright red. D. Cloudy white. Question 190. Answer: A dark brown. Question 190. Explanation: About 12 to 24 hours after a subtotal gastrectomy, gastric drainage is normally brown, which indicates digested blood. Bile green or cloudy white drainage is not expected during the first 12 to 24 hours after a subtotal gastrectomy. Drainage during the first 6 to 12 hours contains some bright red blood, but large amounts of blood or excessively bloody drainage should be reported to the physician promptly.